Okay, welcome everybody. This is our podcast on Chapter 10. We're going to go through some of the major muscles of the human body, their location, what they look like, and their origins and insertions, and their actions, that it would be what they do when they contract. So remember that muscle tissue is contractile tissue, and there's three flavors of muscle tissue: skeletal, which is attached to bone; cardiac, which is found only in the heart; and smooth muscle, which is found in the walls of organs like the stomach, the small intestine, in the walls of blood vessels and lymphatic vessels, um, and is under involuntary control; and cardiac muscle, which is also under involuntary control. Skeletal muscle um, essentially is under the control of our voluntary action, so we tell it what to do. So we're going to focus on skeletal muscle in this chapter. We're going to talk about how muscles interact to generate movement. We're going to talk about criteria for naming muscles. Um, we'll touch briefly on principles of leverage. And with that, let's begin. So muscles can only pull, they never push. And what one muscle group will do, the other will undo. We call the muscle group that performs the action the prime mover. We call the muscles that assist that muscle group the agonist, and the muscle group that opposes that action the antagonist. So there are different functional groups for muscles. The prime mover is the major responsibility for generating that particular action, while the antagonist opposes or reverses that particular movement. The prime mover and the antagonist are usually on opposite sides of the joint that they act on, and we'll get to some examples in just a little bit. The synergist or agonist will help the prime mover. It adds extra force to the movement and it reduces unnecessary movement, while the fixator essentially locks the bone's origin in place and gives the prime mover a stable base across which to act. The same muscle can be a prime mover of one movement, can be an antagonist for a different movement, and can be a synergist for even a third movement. A lot of these muscles, as we're going to find out, have a variety of attachment points, and different parts of the muscle can contract to produce different types of actions. And so what you're looking at here are just some different examples of muscles and how they act. Here we're seeing an example of a muscle in the chest called the pectoralis major, and what happens when it flexes is that it's going to flex the arm. Remember that when we talk about flexion, we're referring to anatomical position, and we're reducing the angle of the two elements in anatomical position. So what's happening here as the arm goes up is that we're decreasing the angle between the arm and the plane of your body. Here we can see another example, a muscle that crosses on the posterior side of the joint that produces extension. Down here, this is the muscle known as the latissimus dorsi, and you can see here that when it contracts, it is going to extend and even hyperextend the arm. So the arm is going to move back beyond the anatomical plane, and that's the definition of extension and hyperextension. A muscle that crosses on the lateral side of the joint can produce abduction. And so you can see here the deltoid muscle, which actually has three parts. It has an anterior, a medial, and a posterior belly. It inserts onto the middle of the humerus on the lateral side. And when the center of the muscle contracts, it raises the arm up away from midline, and we call that abduction. A muscle that runs on the medial side of the joint can produce adduction. This is the teres major, and it runs from the medial border of the lateral border of the scapula to the humerus, and when it contracts, it is an adductor muscle. Okay, so you'd see here some different muscle actions depending on, again, where they're attached to the skeleton. Now, when we name skeletal muscle, we use different criteria. Not all criteria are present in every muscle name, but some of these criteria are going to be present in each muscle name. We can name muscles according to their location, which would be the bone or the body region that they're associated with. We can name muscles according to their shape. A lot of times these shapes will be in the form of letters or of geometrical figures. Okay, an example of a couple of muscles named by their shape include the deltoid and the rhomboid muscles. A muscle named for its location would be a muscle such as the rectus abdominis, which is in the abdominal region. Sometimes muscles will be named according to their size. We call that their relative size. You're usually in a group of muscles. You'll have a small muscle, a big muscle, and an even bigger muscle, as an example. Maximus is generally indicating the largest muscle, minimus the tiniest, longus would be the longest muscle, and brevis would be the shortest muscle. The direction of fibers can also be used as a naming criteria. For example, if we have rectus in the name, that means that the muscle fibers run parallel to the long axis of the body. If we have transverse in the muscle name, we mean that the fibers run perpendicular to the long axis of the body. And if we have oblique in the name, it runs at an angle in between those two angles, something like 45 degrees or some other angle to the long axis of the body. Examples of muscles with names like that include the rectus abdominis, whose fibers run essentially along the longitudinal axis, the transverse abdominis, whose muscles run perpendicular to the long axis of the body, and the internal and external oblique muscles, which are also in the lateral abdominal region, and their fibers run at an angle to the long axis of the body. We can also name them according to their number of origins. For instance, the biceps femoris or the biceps brachii have 2 origins. The triceps brachii has 3. The biceps brachii and triceps brachii are found in the arm. The biceps femoris is found in the back of the leg. So you can see here that we can combine some of these. Biceps brachii, the bicep tells you the number of origins. Brachii tells you it's in the upper arm region, as an example of a compound name for the muscle. Biceps femoris. Femoris indicates that it's near the femur. Bicep, again, a 2-headed muscle. The location of attachments is also critical. They're named according to their point of origin and insertion. The origin is generally named first, and then the muscle action, which will be named for the action they produce, either flexors or extensors. There are several criteria that can be combined. For instance, the extensor carpi radialis longus combines the action, the location, the carpal region is in the wrist. Radialis means that it has an attachment to the radius, and longus means that it's a long muscle. So you can get a lot of information out of these different muscle names. There's over 600 muscles in the body, but we're only going to learn a fraction of those muscles, but we'll learn the most important ones. They're grouped by their function and by their location. The information for each of these muscles is going to include their shape, their location relative to other muscles, their origin and insertion, which is usually a joint between the origin and insertion that is moved as a result of the muscle contracting, and this generates its action, where the insertion moves towards the origin. The innervation is the name of the major nerve that talks to that muscle and, using an electrical signal, tells that muscle to contract, i.e. to move. And so here you can see the major muscles of the body. To learn these, be aware of the information learned from the muscle name, read the description and identify it on the figure in your textbook, and relate the location to the description, and relate the attachments to their actions, and act out the movements on yourself. And we'll go through each of these muscles in detail. This is just to show you essentially where we're going to be going. Okay, so I won't go through every single muscle in this diagram here, as we're going to get to them as we hit each of those body regions, but I will tell you a couple of things about this picture. Number one, if you look here in the chest and the abdominal region, notice that you've got different muscles on the right side of the body versus on the left side of the body, and the reason for that is that the right side of the trunk here is the superficial side The left side here is the deep side. So the muscles over here are underneath the muscles that are over here. And that's also true to some extent with the muscles that we're going to see um, in the arms and in the legs. Okay, these look both like superficial to me, as do the arms. So I think the only deep and superficial is in this region right here. And what I want you to notice about a lot of these muscles is that they're named for um, their location or the bones that they attach to or what they do. We can take a few examples, some really straightforward muscles that we're going to need to know, like the sternocleidomastoid is named for its attachments to bones. It's attached to the sternum, it's attached to the clavicle, and it's attached to the mastoid process of the temporal bone, and that's what gives it its name, and its job is to flex the head. In the thoracic region, we have the pectoralis major, which is this big muscle on top, and underneath it, the pectoralis minor, and its job is to move the arm. The serratus anterior is this sawtooth muscle that's on the lateral side of the chest. Its major action is throwing and punching, and the intercostals, which are between the ribs, are there primarily to help you breathe. The arm, over here, the upper arm, you can see the triceps brachii, a three-headed muscle on the back of the humerus that extends the elbow. The biceps brachii, which is a two-headed muscle on the front of the humerus that flexes the elbow, and the brachialis, which is a muscle that's underneath the biceps brachii, which also helps to flex the elbow. And again, notice that in each one of these muscles, the term brachii or brachial is included in the name, and that tells you something about the location. An example of a muscle that's named for its shape is the deltoid muscle. It's shaped like the Greek letter delta, which looks like a triangle. The deltoid muscle looks like an upside down triangle, and its major job is in the flexion and extension and hyperextension of the arm, and also the abduction of the arm, the movement of the arm away from midline. The forearm muscles we're not going to concentrate on that much. They're primarily there to move the wrist and in some cases the fingers. Muscles that we find in the upper leg, the thigh region, include the iliopsoas muscle, which is a muscle that's a combination of two muscles, the iliacus muscle, which sits in the ilium of the hip, and the psoas major muscle, which runs medial to that. The pectineus muscle is a little tiny adductor muscle on the medial side of the leg, and it helps bring the leg back towards midline. In the thigh, you've got a set of four muscles that are very important in kicking, and these include the rectus femoris, whose name comes from the fact that the fibers run along the long axis of the body, the vastus lateralis, this large muscle on the lateral side of the leg, the vastus medialis, the muscles on the medial side of the leg, and then down here you've got the fibularis longus and brevis, which run next to the fibula, which is the medial bone of your lower leg, and the tibialis anterior, which is involved in lifting the toe, okay, and it gets its name from its location right in front of the tibia. On the back of the lower leg, you got two muscles that help you point the toe. Those are the gastrocnemius, which is the superficial muscle, and the soleus, which is underneath it, and it also helps you to point the toe. So these muscles help you to push off on the ball of your foot and to walk. Muscles of the abdomen are named again for their location. Abdominis meaning in the abdominal region. The rectus abdominis is this muscle here. This is part of your six-pack, and it's involved in flexion of the hip. The external and internal obliques are these lateral muscles. The external oblique, the most superficial muscle on the lateral side of the abdomen, and the internal oblique underneath it. They're called oblique because their fibers run at an angle to the long axis of the body. And then you've got some muscles here in the thigh that help to rotate the leg and adduct the leg, and these include the gracilis, a little strap-like muscle on the medial thigh, the adductor longus, again, The name tells you what it does. It brings the leg back towards midline. The sartorius, which is this S-shaped muscle that runs right across the front of the thigh. Its nickname is the tailor muscle, and its job is to laterally rotate the leg. And this muscle up here that sort of breaks in the opposite direction, the tensor fascia latae, or TFL, it inserts onto a piece of connective tissue called the iliotibial band, which gets its name from the fact that it runs from the ilium all the way to the tibia and inserts actually down here right around the tibial tuberosity, that little bump just below your kneecap. And its job, again, is to essentially um, allow you to walk and jog. It also can laterally rotate the leg. Okay, so um, important muscles that we'll get to. Okay, now what we're looking at here is just the superficial muscles from the posterior aspect. So we're looking at the back. And again, the names are going to reflect in some cases the muscle's location, in some cases their shape, in some cases their action, uh, their relative size, and in some cases the direction of their fibers. So if you start up here, an important muscle to know is the sternocleidomastoid, which flexes the head down onto the neck. It's named for its attachments. It attaches to the sternum, the clavicle, and the mastoid process of the temporal bone. You've got the trapezius, this big sort of diamond-shaped muscle back here, which is responsible for moving the shoulder and also moving the head. In the shoulder region, you can see that we have the deltoid, named for its shape. It's shaped like a triangle, an upside-down triangle, and it's responsible for flexion, extension, and hyperextension of the arm, as well as abduction of the arm, the movement of the arm away from midline. We've got the infraspinatus, which is one of the rotator cuff muscles, and it is, of course, responsible for moving the arm. The teres major, also responsible for moving the arm. And then you've got a couple of muscles called the rhomboids, which are actually underneath the trapezius. Um, there's two rhomboid muscles, the rhomboid major and the rhomboid minor, and they sit underneath the trapezius. So this label is trying to show you that these are deep muscles. The latissimus dorsi, again, a big, large, flat muscle that attaches to the humerus and is responsible for moving the arm. Down here in the hip, you've got the gluteus maximus, this big superficial muscle, um, obviously named for its location in the gluteal region. This muscle helps hyperextend the leg, helps us walk. Underneath it is a smaller muscle called the gluteus medius, which assists it in this movement. And then underneath the medius, there's an even smaller muscle called the gluteus minimus. So again, gluteal for the location, and maximus, medius, and minimus for the relative size. Back here on the thigh, you've got a group of three muscles that we are colloquially called the hamstrings. I'm sure you've heard of athletes having a hamstring injury. The major muscles of the hamstrings include the biceps femoris. Again, it gets its name because it has two heads and is near the femur. The semitendinosus, which is medial to the biceps femoris, and the semimembranosus, which is medial to the semitendinosus and also underneath it. And what these muscles do is they help flex the knee. Okay, so these muscles essentially allow you to bend the knee. They oppose the action of the quadriceps muscles, which are on the front of the thigh. Down here in the leg, you've got the gastrocnemius and the soleus. The gastrocnemius is this two-headed muscle that's on the superficial aspect, and the soleus is a cone-shaped muscle underneath. They both insert onto the Achilles tendon, which hooks to the bottom of your heel bone, and this muscle helps, these two muscles help you point your toe. So this allows you to push off on the ball of your foot when you walk. And then you've got a couple of muscles on the lateral side of the leg that are important, the fibularis longus and the fibularis brevis, which help you evert the foot, basically turn the sole of your foot outwards away from midline so that the plantar surface is facing this direction. Moving up here to the iliotibial tract, this is an important band of connective tissue. The gluteal muscles insert onto this along with the tensor fascia latae on the front of the thigh, and this band runs all the way down the lateral aspect of the thigh and inserts onto the tibial tuberosity, which is that bump just underneath your kneecap, and it again assists you in walking and running. The muscles of the forearm we won't go into a lot of detail on. Again, they're named according to their location and their action. Um, the brachioradialis is named for its attachment points. It attaches to the humerus, which is in the brachial region, and the radius, which is on the thumb side of the forearm. The extensor carpi radialis allows you to extend the wrist. So basically, in anatomical position, you can flip your wrist backwards. Okay. It also allows you to hyperextend the wrist. The flexor carpi ulnaris is again named for its attachment to the ulna and its action, which is to flex the wrist. That's literally what the name means. The extensor digitorum allows you to extend the fingers. The extensor carpi ulnaris allows you, again, to extend the forearm. And again, it's named for its attachment. It attaches to the wrist and also to the ulna. Okay, so this allows you, again, to extend the wrist and even hyperextend the wrist to some degree. Muscles of the head come in two groups: the muscles of facial expression and the muscles of mastication, which is chewing, and movement of the tongue, which of course is involved in eating and in speech. So the muscles of facial expression insert onto the skin, and they're important in nonverbal communication. They provide a lot of our facial expression. All of these are innervated by cranial nerve 7, which is the facial nerve. And that's a mixed nerve to the face. It's both sensory and motor. And so here you can see some of the muscles of facial expression. If we start with the scalp, we have the epicranius, also sometimes called the occipitofrontalis, and it's this muscle that runs across the frontal bone of the skull and is attached by this broad flat tendon called an aponeurosis to the occipitalis, which runs across the surface of the occipital bone of the skull. The frontalis allows you to raise your eyebrows. Um, the cranial aponeurosis connects the two bellies. There's a frontal belly and an occipital belly. It allows you to pull the scalp forward and backward. Okay, on the face, we've got a couple of muscles that control expression. The corrugator supercilii, a little muscle here under your eyebrow, allows you to frown. The zygomaticus, there's a major and a minor. The major is longer than the minor, and what they do is they connect from the zygomatic bone to the corners of the mouth. These allow you to smile. The risorus, okay, another muscle, again, it's attached to the corners of the mouth, and this draws the mouth laterally, okay? So this might be the expression you'd make if you were exasperated with something, kind of broadening and flattening the mouth. The levator labii superioris, again named for what it does. It elevates the lip, and it's on top of the lip. So if you find that muscle here, it's going to be essentially on the top, okay, and it's going to pull the top of the lip up. So this allows you to snarl. It's not specifically labeled on, well, here it is. It's right there. Okay, you can see the label right there. The depressor labii inferioris basically pulls the lower lip down. Okay, you can see it right there. Labia refers to the lips. Depressor means to pull down. Levator means to raise up. So again, the action is in the name of this muscle. The orbicularis oris is a round muscle that surrounds the mouth, and this allows you, for instance, to whistle or to kiss. The mentalis is a tiny muscle down here that attaches to the midline of the lower lip, allows you to pull the lower lip down. The buccinator is the muscle that allows you to suck and blow, and it's a deep muscle here underneath the masseter. This is the masseter, the muscle of chewing. The buccinator is this guy underneath the rosaurus and the masseter, and this allows you to suck and blow. And then finally, the platysma is this broad, flat muscle right here, and what it does is it allows you to pull the corners of the mouth down. It's a big, flat muscle that lies right on top of the sternocleidomastoid, and again, a lot of the muscles, the deep muscles that move the lips. Okay, so here you can see the muscles of chewing, that's mastication. The main ones being the temporalis and the masseter. The temporalis is named because it lies over the top of the temporal bone, and the masseter connects from the zygomatic bone to the base of the mandible. And again, these guys let you basically raise the jaw. Okay. Um, the buccinator also has some role in this. Remember, it's involved in moving the cheeks, and the orbicularis oris, as we already indicated, is responsible for changing the shape of the lips, allowing you to suck and blow. The four pairs of muscles that are involved in chewing are all innervated by the trigeminal nerve. That's your fifth cranial nerve. They are prime movers of jaw closure and jaw movement. The temporalis and the masseter primarily responsible for grinding movement. And then you can see some deeper muscles, the medial and the lateral pterygoids, which are named again for their attachment to the pterygoid processes of the sphenoid bone, allow side-to-side movement of the lower jaw so that you can grind your food while you eat it. The chewing roll, the muscles that hold the food between the teeth, include the buccinator. Okay, again, they keep the cheeks closed and allow the food not to escape. Okay, the muscles of the neck and the vertebral column have two functional groups. There's muscles that move the head and muscles that extend the trunk and maintain posture. So here we see again a look at the head and the neck. Here we're looking at the back, and here we're looking also at the deeper muscles in the back. So the sternocleidomastoid, again named for its attachments to the sternum, the clavicle, and the mastoid process of the temporal bone, is a major head flexor. The suprahyoid and infrahyoid muscles are assistants in head flexion, and again they attach to the hyoid bone, and you can see them, I think, on a subsequent slide. They're not really shown here. The sternocleidomastoid and the scalenes involve lateral head movement, so tilting your head from side to side, while the splenus capitis is involved in head extension, rotation, and lateral bending. And the semispinalis capitalis is a synergist that helps the sternocleidomastoid perform such functions as flexing the head onto the neck. The muscles of posture you can see running up and down the spine along the long axis. There are some deep back muscles. They're called intrinsic. They include the erector spinae. This is the sacrospinalis group, and these are prime movers of back extension and lateral bending. If, like, you flex one side of the erector spinae, you'll tilt to the left. If you flex the other side, you'll tilt to the right. If you flex both of them, you'll stand up straight. And you can see the erector spinae group here. Okay, again, essentially they're deep muscles of the back, and they run along the longitudinal axis of the body. So you can see them here and here, and iliocostalis right there. Okay, so going from medial to lateral. Okay, all right. The longissimus, the iliocostalis, the spinalis, all help you stand up straight. The semispinalis and the quadratus lumborum are synergists in extension and rotation. You can see the quadratus lumborum. It runs from the floating ribs down to the iliac crest. You can see right here. Okay, and the semispinalis you can pick up here. It comes in several divisions, right? There's a cervical division, there is a thoracic division, and again, they assist in extension and also rotation of the trunk. Okay, that brings us to the end of this block, and we will continue in a moment. Okay, we're continuing with part B of the muscular system. We're going to move into the muscles of the abdominal region and the thoracic region. And we're going to look at a little bit more detail at the muscles that allow us, for instance, to breathe. The muscles of respiration include the diaphragm and the external and the internal intercostals. The external intercostals are superficial muscles and they elevate the ribs for inspiration, so that's breathing in, while the internal intercostals are deeper muscles and they aid in forced expiration, so that's blowing out. So you can see that the external intercostals are superficial and lateral and run between the ribs, while the internal intercostals are deep and more medial and run between the ribs, and they aid again in breathing. So with that, let's take a listen to the muscles of breathing.
The origins of the external intercostals are from the inferior borders of the ribs above. The fibers pass obliquely and inferiorly to insert onto the superior borders of the ribs below. The external intercostals elevate the rib cage during inspiration. They are innervated by the intercostal nerves. The origins of the internal intercostals are from the inferior borders of the ribs and costal cartilages above. The fibers pass inferiorly and posteriorly to insert onto the superior borders of the ribs and costal cartilages below. The internal intercostals, especially the posterior portion, depress the rib cage during forced expiration. They are innervated by the intercostal nerves.
Here you can see the diaphragm. It's a partition between the thoracic and the abdominal cavities. It's a broad, sort of flat muscle, the most important muscle in inspiration, and it's innervated by the phrenic nerve. So you're looking here at the underside of the diaphragm. This is the xiphoid process of the sternum. This is where the inferior vena cava that brings blood back to the heart runs through. And this is an area called the esophageal hiatus. This is where the food tube that connects your mouth to your stomach runs through and brings food down into the stomach, which would lie right about here. And remember that this is the right side of the diaphragm, this is the left side of the diaphragm, and then of course this is the spinal cord, and you can see here um, the lumbar vertebra and the anterior ligaments. So when we breathe, what happens is that the the phrenic nerve will innervate, basically signal the diaphragm to contract. And when it contracts, what will happen is that it'll flatten, and that'll increase the volume of the thoracic cavity, which will produce a vacuum around the outside of the lungs. And if your nose or your mouth or both are open, what will happen is that the vacuum will pull air into the lungs. That'll ventilate the lungs, and then the oxygen from the air that you breathe will cross through the delicate tissue of the lungs known as alveoli and into the bloodstream, and then that blood will eventually be carried back to the heart, where the heart will then pump it to the rest of the body. Uh, while we're awake, we consciously control this muscle, and when we're asleep, this muscle rhythmically contracts and relaxes. But how that actually happens is a little bit of a mystery, because um, somehow it's being periodically innervated while we sleep, but we haven't really figured out what part of the brainstem makes that happen. But occasionally, what can occur is that the diaphragm can stop moving while we sleep permanently, and that's a condition known as central sleep apnea, and that can lead to death. And it's thought to be a contributing factor in a condition known as SIDS, which stands for sudden infant death syndrome. It used to be known as crib death. There's another type of sleep apnea which you may be familiar with, which is obstructive sleep apnea. And in this condition, what happens is that the upper airway gets blocked as a result of, for instance, the soft palate closing off portions of the pharynx, or fat around the neck closing off the upper airway, and then you can't get air into the lungs. And generally, what happens when that occurs is you wake up. So, two types of sleep apnea. These are the muscles of the abdominal wall. There are four paired muscles, and they have fascia that hold them together, and broad flat tendons called aponeuroses that form the lateral and the anterior abdominal wall. The muscles are the rectus abdominis, and it's named that because its fibers run along the long axis of the body. The external obliques, which are named such because of the direction of their fibers, is at an oblique angle to the body. The internal obliques, which you can see over here on this side, which are underneath the externals, and again are named that because their fibers run at an angle to the long axis of the body. And the transverse abdominis, which is the deepest layer of abdominal muscle tissue, whose fibers run at a right angle to the long axis of the body. And what do these muscles do? Well, you use these muscles when you do sit-ups. You use these muscles when you defecate, or when you urinate, or when you give childbirth. And these muscles also can rotate and flex the trunk. If we look here at the muscles in a superficial and deep view, what you can see here is that the fascicles run at angles to each other, and they provide added strength. Again, because of the different directions of the fibers, there's no shared weak spot in these muscle layers. They're all innervated by the intercostal muscles. They provide lateral flexion and rotation of the trunk. They promote urination, defecation, and childbirth, also contribute to vomiting, coughing, and screaming. And what you can see here, again, is a look from superficial to deep from the lateral view. So that's the external oblique. Underneath it, you can see the internal oblique, and you can pick up the rectus abdominis once we've moved this aponeurosis out of the way. And then the deepest set of muscles are the transverse abdominis, which run again have fibers that run at right angles to the long axis of the body. This is just a transverse section through the abdominal wall, and what you can see is that at midline, what we have primarily are the rectus muscles, and then as we move laterally, what we see are the external and internal obliques, and then underneath them, the transverse abdominis. So let's take a listen to the muscles of the abdominal wall.
The origins of the external obliques are from ribs 5 through 12. The insertions of the external obliques are to the linea alba via its aponeurosis, the pubic crests and tubercles, and the iliac crests. Acting bilaterally, the external obliques support and compress the abdomen and flex the vertebral column anteriorly. Acting unilaterally, the external oblique laterally flexes and rotates the vertebral column to the opposite side. Due to the compressive effect on the abdomen, the external obliques raise intra-abdominal pressure and assist in forced expiration. They are innervated by the intercostal nerves. The origins of the internal obliques are from the thoracolumbar fascia, the iliac crests, and the inguinal ligaments. The insertions are to the linea alba via a broad aponeurosis, the pubic crests, and ribs 10 through 12. Acting bilaterally, the internal obliques support and compress the abdomen, raise intra-abdominal pressure, and flex the vertebral column anteriorly. Acting unilaterally, the internal oblique laterally flexes and rotates the vertebral column to the same side. Due to the compressive effect on the abdomen, the internal obliques assist in forced expiration. They are innervated by the intercostal nerves. The origins of the rectus abdominis muscles are from the pubic symphysis and the pubic crests. The insertions are to the xiphoid process of the sternum and the costal cartilages of ribs 5 through 7. The rectus abdominis muscles flex the vertebral column anteriorly. Rectus abdominis muscles also increase intra-abdominal pressure for abdominal breathing as during childbirth. They are innervated by the intercostal nerves. The origins of the transversus abdominis muscles are from the inner surfaces of costal cartilages 7 through 12. The thoracolumbar fascia, the iliac crests, and the inguinal ligaments. The insertions are to the linea alba via a broad aponeurosis, the pubic crests, and the pectineal line of the pubic bones. The transversus abdominis muscles compress the abdomen and in doing so raise intra-abdominal pressure and assist in forced expiration. They are innervated by the intercostal nerves.
Okay, now the muscles of the thorax, that's the chest region, are mostly involved with moving the shoulder. They act in combination to fix the shoulder girdle, which mostly involves the scapula, and to increase the range of arm movement. And their action includes elevation, depression, rotation, and lateral and medial movement of the scapula, as well as protraction and retraction of the scapula. Remember that protraction is to move the scapula forward, retraction is to pull the scapula backwards. There's two groups of muscles, the anterior and the posterior. So let's take a listen.
The shoulder joint is the most flexible joint in the body. Therefore, the muscles that act on the joint must show extensive mobility and consequently exhibit an especially complex array. However, the muscles of the shoulder can be divided into separate groups based on distribution and functional relationships. These groups consist of muscles that act on the pectoral girdle, specifically the scapula, the muscles of the rotator cuff, or those that stabilized the glenohumeral joint, and muscles that cross the glenohumeral joint.
Here we can see a little bit more detail about the muscles that move the pectoral girdle.
The pectoral girdle refers to the bony arch formed by the clavicle and the scapula. The primary function of the pectoral girdle is to act as an attachment point for the muscles that provide arm movement at the shoulder joint. It also provides the only connection between the arm and the axial skeleton. Muscles that act on the pectoral girdle, specifically the scapula, can be divided into anterior and posterior groups. Two muscles comprise the anterior group, the pectoralis minor and the serratus anterior. The pectoralis minor muscle originates on the anterior surfaces of ribs 3 to 5 and inserts on the coracoid process of the scapula. The serratus anterior muscle originates from ribs 1 to 8 and inserts on the anterior vertebral border of the scapula. There are four muscles that comprise the posterior group: the levator scapulae, the rhomboid minor, the rhomboid major, and the trapezius. The levator scapulae muscle originates on the transverse processes of vertebrae C1 through C4 and inserts on the medial border of the scapula just superior to the spine of the scapula. The rhomboid minor muscle originates on the spinous processes of vertebrae C7 through T1 and inserts on the medial border of the scapula at the level of the spine of the scapula. The rhomboid major muscle originates on the spinous processes of thoracic vertebrae 2 through 5 and inserts on the medial border of the scapula inferior to the spine of the scapula. The trapezius muscle originates on the external occipital protuberance, the medial 1/3 of the superior nuchal line, and the spinous processes of vertebrae C7 through T12. Insertion of the trapezius muscle makes a continuous line from the acromion and spine of the scapula to the lateral 1/3 of the clavicle. The scapula of the pectoral girdle is loosely attached to the thoracic cage and consequently capable of considerable movement. To best illustrate the scapular movements, 6 actions of the scapula will be animated. Lateral rotation, or raising of the glenoid cavity. Medial rotation, or lowering the glenoid cavity. Elevation. Depression. Protraction. And retraction. Lateral rotation of the scapula results from contraction of the serratus anterior and the trapezius muscles. Medial rotation results from the contraction of the levator scapulae and the rhomboid major and minor muscles. Elevation of the scapula occurs through the levator scapulae, the major and minor rhomboids, and the trapezius muscles. Depression of the scapula is caused by the serratus anterior and the trapezius muscles. Scapular protraction is caused by the serratus anterior and the pectoralis minor muscles. Scapular retraction is caused by both rhomboids and the trapezius muscle.
Okay, the muscles of the anterior thorax include the pectoralis minor, the serratus anterior, and the subclavius. Pectoralis minor is again involved in the protraction of the scapula. Serratus anterior is the muscle that would be involved in punching or throwing, and we'll also detail what the subclavius does. So take a listen.
The origins of pectoralis minor are from ribs 3 through 5. The insertion is to the coracoid process of the scapula. With the origin fixed, pectoralis minor tilts the scapula anteriorly. With the insertion fixed, it draws the rib cage superiorly to aid in forced inspiration. It is innervated by the pectoral nerves. The origins of serratus anterior are from ribs 1 through 8. The insertion is to the costal surface of the medial border of the scapula. Serratus anterior abducts the scapula and laterally rotates the scapula upward by moving the glenoid cavity superiorly and the inferior angle laterally. The superior fibers elevate the scapula, while the inferior fibers depress it. It is innervated by the long thoracic nerve.
These are the posterior extrinsic shoulder muscles. They include the trapezius, the levator scapulae, and the rhomboids, both major and minor. In this diagram, note that this is the superficial side of the muscles of the back, and this is the deeper side. And so you can see here, trapezius, latissimus dorsi, you can pick up the deltoid, levator scapulae, the rhomboid major, and the rhomboid minor. And you can see the supraspinatus, the infraspinatus, the teres major, and then this little guy right here is the teres minor. Those are rotator cuff muscles. So let's take a look at the superficial muscles of the posterior thorax.
The trapezius is the large trapezoid-shaped muscle located in the posterior thorax and neck. It may be separated into three groups of fibers: superior, middle, and inferior. The origins of the superior fibers are from the external occipital protuberance, the superior nuchal line, the ligamentum nuchae, and the spinous process of vertebrae C7. The insertions are to the lateral 1/3 of the clavicle and acromion of the scapula. With the origin fixed, the superior fibers elevate the scapula, gliding it toward the skull. The superior fibers also laterally rotate the scapula upward. With the insertion fixed and the muscle contracting on one side only, the superior fibers laterally flex and rotate the head and neck to the opposite side. With the insertion fixed and the muscle contracting on both sides, the superior fibers extend the neck. The superior fibers are innervated by the spinal accessory nerve. The origins of the middle fibers are from the spinous processes of vertebrae T1 through T5. The insertions are to the medial border of the acromion and the superior lip of spine of the scapula. With the origin fixed, the middle fibers adduct the scapula. This is a gliding movement toward midline. The middle fibers are innervated by the spinal accessory nerve. The origins of the inferior fibers are from the spinous processes of vertebrae T6 through T12. The insertion is to the tubercle of the spine of the scapula. With the origin fixed, the inferior fibers depress the scapula, gliding it inferiorly. The inferior fibers also laterally rotate the scapula upward. The inferior fibers are innervated by the spinal accessory nerve. The origins of levator scapula are from the transverse processes of cervical vertebrae 1 through 4. The insertion is to the upper 1/3 of the medial border of the scapula. Levator scapula elevates the scapula and pulls the glenoid cavity inferiorly. It is innervated by the cervical nerves and the dorsal scapular nerve. The origins of rhomboid major are from the spinous processes of vertebrae T2 through T5. The insertion is to the medial border of the scapula. Rhomboid major elevates the scapula, adducts the scapula, and medially rotates the scapula downward by moving the glenoid cavity inferiorly and the inferior angle medially. It is innervated by the dorsal scapular nerve. The origins of rhomboid minor are from the ligamentum nuchae and the spinous processes of vertebrae C7 and T1. The insertion is to the medial border of the scapula. Rhomboid minor elevates the scapula, adducts the scapula, and medially rotates the scapula downward by moving the glenoid cavity inferiorly and the inferior angle medially. It is innervated by the dorsal scapular nerve.
Okay, we'll continue in a minute. Okay, this is the third installment in our discussion on the muscles, and we want to talk about the shoulder joint next. There are 9 muscles that cross this joint, and they insert on and they move the humerus. Some originate from the scapula, that's your shoulder blade, and others from the axial skeleton, and their actions include flexion, extension, and adduction. There's 3 prime movers of the arm. They're the pec major, the large muscle right in the front of your chest. It's a superficial muscle. The latissimus dorsi, which is a muscle on the lower part of your back that lies just under the trapezius, and the deltoid muscle, which is the big fleshy muscle in your upper arm that's shaped a little bit like an upside down triangle. So let's take a listen to the muscles that cross the shoulder joint.
The pectoralis major is the large superficial muscle of the arm located in the anterior thorax. It may be separated into two groups of fibers, superior or clavicular, and inferior or sternocostal. The origin of the superior or clavicular fibers is from the anterior surface of the medial one-half of the clavicle. The insertion is to the lateral lip of the intertubercular groove of the humerus. The origins of the inferior or sternocostal fibers are from the anterior surface of the sternum, the costal cartilages of ribs 1 through 7, and the aponeurosis of the external oblique muscle. The insertion is to the lateral lip of the intertubercular groove of the humerus. Acting as a whole, the key actions of the pectoralis major are medial rotation and adduction of the arm. Medial rotation is a movement during which the anterior surface of the arm turns toward midline. Adduction is a movement in a medial direction toward the mid-sagittal plane. The pectoralis major also assists in extending the arm at the shoulder from a flexed position. The latissimus dorsi is the large triangular-shaped muscle of the upper limb, which has an extensive origin from the posterior thorax and abdomen. The origins of the latissimus dorsi are from the posterior lip of the iliac crest, the spinous processes of vertebrae L5 through T7, and ribs 8 through 12, via the thoracolumbar fascia. The insertion is to the intertubercular groove of the humerus. Latissimus dorsi extends the arm at the shoulder. From a state of flexion, it moves the arm to an anatomical position or to a state of extension, and beyond this to a state of hyperextension. It also adducts the arm by moving it in a medial direction toward the midsagittal plane, and medially rotates the arm by turning the anterior surface of the arm toward midline. Latissimus dorsi is innervated by the thoracodorsal nerve. The deltoid is the large fleshy muscle we most associate with the shoulder complex. It may be separated into three groups of fibers: anterior, middle, and posterior. The origin of the anterior fibers is from the lateral one-third of the clavicle. The insertion is to the deltoid tuberosity of the humerus. The anterior fibers move the arm forward from anatomical position, thus flexing the arm at the shoulder. They also medially rotate the arm by turning the anterior surface of the arm toward midline. They are innervated by the axillary nerve. The origin of the middle fibers is from the acromion of the scapula. The insertion is to the deltoid tuberosity of the humerus. The middle fibers abduct the arm. They are innervated by the axillary nerve. The origin of the posterior fibers is from the inferior border of the spine of the scapula. The insertion is to the deltoid tuberosity of the humerus. The posterior fibers extend the arm at the shoulder. And laterally rotate the arm by turning the anterior surface of the arm away from midline. They are innervated by the axillary nerve.
Now, the rotator cuff muscles are synergists and fixators, and they have their origin on the scapula, and they reinforce the shoulder capsule and prevent dislocation. And the way to remember the rotator cuff muscles is through the acronym SITS, S-I-T-S, which stands for supraspinatus, which lies in the supraspinous fossa of the scapula, the infraspinatus, which lies in the infraspinous fossa of the scapula, the teres major, which lies just underneath the infraspinatus, and the subscapularis, which lies on the anterior portion of the scapula in the subscapular fossa. The coracobrachialis and the teres major are synergists, meaning they help each other to move the arm. So let's take a look at the muscles that cross the shoulder joint, and then we'll do a little bit on how the rotator cuff operates.
There are 9 muscles that cross the shoulder joint and act on the humerus. Of these 9 muscles, only 3, the latissimus dorsi, the pectoralis major, and the deltoid muscles are considered prime movers of the shoulder joint. The other 6 muscles play a synergistic role in movement, but their primary role is to stabilize the shoulder joint. 4 of these, the supraspinatus, infraspinatus, teres minor, and the subscapularis, are grouped as the rotator cuff muscles and are discussed separately. The remaining 2 muscles are the teres major and the coracobrachialis. The muscle origins and insertions in relation to the glenohumeral joint are best introduced as anterior and posterior muscles that originate off of the scapula, and anterior and posterior muscles that originate off the axial skeleton. The rotator cuff is a term used to describe the group of muscles and tendons that stabilize and reinforce the glenohumeral joint and assist with the angular and rotational movement of the humerus. All 4 muscles combine at the humeral head by way of tendons and form a cuff over the joint, hence the name rotator cuff.
The origin of teres major is from the posterior surface of the inferior angle and lower 1/3 of the lateral border of the scapula. The fibers run superiorly and laterally to insert onto the medial lip of the intertubercular groove of the humerus. Teres major adducts the arm, medially rotates the arm, and extends the arm. It is innervated by the lower subscapular nerve.
The rotator cuff is comprised of 4 muscles: the subscapularis, the supraspinatus, the infraspinatus, and the teres minor. The subscapularis muscle originates on the anterior portion of the scapula within the subscapular fossa and inserts on the lesser tubercle of the humerus. This angle allows the subscapularis muscle to provide medial rotation and prevent the humeral head from sliding upward out of the joint as the arm is raised. The supraspinatus muscle originates on the posterior surface of the scapula, above the scapular spine, within the supraspinous fossa, and inserts on the most superior aspect of the greater tubercle of the humerus. This position provides the supraspinatus muscle with the proper angle to abduct the humerus, and more importantly, prevent downward dislocation from the joint when the arm is relaxed or when carrying weight. The infraspinatus muscle originates on the posterior surface of the scapula, below the scapular spine, within the infraspinous fossa, and inserts on the greater tubercle of the humerus. The infraspinatus muscle rotates the humerus laterally and supports the subscapularis muscle by preventing the humeral head from sliding upward when the arm is raised. The teres minor muscle originates on the axillary border of the scapula and inserts on the greater tubercle of the humerus, just below the insertion of the infraspinatus muscle. The teres minor muscle provides for external rotation of the humerus and stabilizes.
The origin of subscapularis is from the subscapular fossa of the scapula. The insertion is to the lesser tubercle of the humerus. Subscapularis medially rotates the arm, and along with all other rotator cuff muscles, it stabilizes the shoulder joint. It is innervated by the subscapular nerves. The origin of supraspinatus is from the supraspinous fossa of the scapula. The insertion is to the greater tubercle of the humerus. Supraspinatus abducts the arm and laterally rotates the arm. Along with the other rotator cuff muscles, supraspinatus stabilizes the shoulder joint. It is innervated by the suprascapular nerve. The origin of infraspinatus is from the infraspinous fossa of the scapula. The insertion is to the greater tubercle of the humerus and the capsule of the shoulder joint. Infraspinatus laterally rotates the arm by turning the anterior surface away from midline, and along with the other rotator cuff muscles, it stabilizes the shoulder joint. It is innervated by the suprascapular nerve. The origin of teres minor is from the posterior surface of the lateral border of the scapula. The insertion is to the greater tubercle of the humerus. Teres minor adducts and laterally rotates the arm. Along with the other rotator cuff muscles, teres minor stabilizes the shoulder joint. It is innervated by the axillary nerve.
So here you can see a look at the shoulder joint from the back and from the front. The posterior view is on the left, the anterior view is on the right. And what we've done here is we've removed the deltoid and we've taken the trapezius out of the way, and you can see the deeper muscles of the rotator cuff. You can pick up the supraspinatus, the infraspinatus, the teres minor, and the teres major from the back. And we've just reviewed all their actions. You can also see the triceps back here. You can see this muscle that's primarily involved in the extension of the elbow. And in the front, we can see the deltoid, the pectoralis major, all involved in arm movement. Of course, the deltoid involved in arm abduction, flexion, extension, and hyperextension, and the pectoralis major also involved in, among other things, medially rotating the arm, and also involved in adduction, bringing the arm back towards midline. Very powerful muscle. There is another muscle underneath it called the pectoralis minor that also assists in some of these functions. And while we're looking at this region, the shoulder and the arm, notice a few other muscles here that have names indicating their location. You can see the biceps brachii here, and underneath it the brachialis. Both of these are elbow flexors, and of course on the backside we already saw the triceps brachii. And then there's another muscle called the brachioradialis that runs from the humerus and inserts onto the radius. And it is involved in elbow flexion, but it also is involved in the lateral rotation of the forearm. So let's take a look again at some more muscles that run across the shoulder joint and what they do.
The anterior scapular muscles that cross the glenohumeral joint are the coracobrachialis, the biceps brachii, and the deltoid. The coracobrachialis muscle originates on the coracoid process of the scapula and inserts on the medial surface of the humeral shaft. The biceps brachii muscle has two parts, a long head and a short head. The short head originates on the coracoid process of the scapula, while the long head originates on the supraglenoid tubercle of the glenoid cavity. The two heads of the biceps come together distally and insert on the radial tuberosity, just distal to the elbow joint. The deltoid muscle is composed of three distinct sets of fibers: the anterior fibers, which originate from the anterior border and lateral third of the clavicle; the middle fibers, which originate on the lateral margin and acromion of the scapula; and the posterior fibers, which originate on the posterior border of the spine of the scapula. All fibers converge to insert at the deltoid tuberosity of the humerus. The posterior scapular muscle that crosses the glenohumeral joint is the teres major muscle. The teres major muscle originates on the inferior angle of the scapula and inserts on the medial edge of the intertubercular sulcus of the humerus. The anterior axial muscle that crosses the glenohumeral joint is the pectoralis major muscle. The pectoralis major muscle originates on the sternal end of the clavicle, the sternum, and the costal cartilage of ribs 1 through 6. All the fibers converge on the lateral edge of the intertubercular sulcus of the humerus to form the insertion point. The posterior axial muscle that acts on the glenohumeral joint is the latissimus dorsi muscle. The latissimus dorsi muscle originates on the spinous processes of vertebrae T7 through L5, the lower 3 to 4 ribs, and the iliac crest and the coccyx via the thoracolumbar fascia. All fibers converge to form a single insertion point within the intertubercular sulcus of the humerus.
So what you're looking at is just a chart summarizing the actions of the muscles that act on the arm, the forearm, and the hand. This is figure 1018 in your textbook. And most important muscles to know: the pec major, the latissimus dorsi, the deltoid, the subscapularis, basically all the rotator cuff muscles, the subscapularis, the supraspinatus, the infraspinatus, the teres minor, the teres major, the biceps brachii, and the triceps. Okay, so what you can see are the different actions. All right, and essentially you've got a choice of 6 actions here, right? You can flex the arm, which means in anatomical position you're raising the arm up and decreasing the angle between the arm and the plane of the body, the coronal plane of the body. Extension, which means that you're bringing the arm down towards anatomical position. And abduction, which means that you're taking the arm away from midline, and adduction, bringing the arm back towards midline. Medial rotation, rotating the arm towards midline, and lateral rotation, rotating the arm away from midline. So let's take a look at movement at the glenohumeral joint.
The interactions of the 9 muscles that cross the glenohumeral joint are complex, and each muscle contributes to more than one movement. Additionally, movement at the glenohumeral The interactions of the 9 muscles that cross the glenohumeral joint are complex, and each muscle contributes to more than one movement. Additionally, movement at the glenohumeral joint can take place in all directions, where associated muscles can act as synergists in one type of movement and then antagonists in another type of movement. Therefore, 6 movements of the joint and humerus will be considered: flexion, extension, abduction, adduction, medial rotation, and lateral rotation. Flexion of the glenohumeral joint results from the contraction of 2 synergists, the coracobrachialis and the biceps brachii, and 2 prime movers, the anterior portion of the deltoid muscle and the clavicular fibers of the pectoralis major muscle. Extension of the joint results from contraction of 1 synergist, the teres major muscle, and 2 prime movers, the posterior portion of the deltoid muscle and the latissimus dorsi muscle. The deltoid muscle, mainly the middle portion, is the prime mover for abduction. However, alone it can only abduct the humerus to an angle of 90 degrees relative to the scapula before the greater tubercle of the humerus presses against the acromion process of the scapula. Further abduction requires that the head of the humerus and the glenoid cavity of the scapula be laterally rotated. Lateral rotation of the humerus is accomplished by 2 rotator cuff muscles, the teres minor, and the infraspinatus, while the serratus anterior muscle laterally rotates the glenoid cavity. Adduction requires two prime movers, the pectoralis major muscle and the latissimus dorsi muscle, and two muscles that act as synergists, the teres major muscle and the coracobrachialis muscle. Medial rotation results from the contraction of the teres major muscle, the latissimus dorsi muscle, the subscapularis muscle as the prime mover, the pectoralis major muscle, and the deltoid muscle.
Now, the muscles that cross the elbow joint are responsible for either flexing or extending the elbow. The anterior flexor muscles include the brachialis and the biceps brachii, which are forearm flexors, so basically they bend the elbow, and the brachioradialis, which is a synergist, so it helps with the flexion of the elbow, and it's also a stabilizer. And remember that looking at its name, you can pretty much figure out where its attachment points are. It attaches to the humerus, which is in the brachial region, and to the radius, which of course is on the thumb side of the forearm. So let's take a look at the muscles that cross the elbow joint.
The elbow joint is a hinge joint. Therefore, the muscles that act on this joint are limited to flexion and extension of the forearm at the radio-ulnar joint, while the forearm itself is capable of pronation and supination. Muscles that extend the forearm are located posteriorly, while those associated with flexion of the forearm are located anteriorly. The forearm flexors consist of the brachialis, the brachioradialis, and the biceps brachii. The brachialis muscle originates on the front distal half of the humerus and inserts on the coronoid process of the ulna. The brachioradialis originates on the lateral supracondylar ridge of the humerus and inserts on the base of the styloid process of the radius. The biceps brachii has two parts, a long head and a short head. The short head originates on the coracoid process of the scapula, while the long head originates on the supraglenoid tubercle of the scapula. The two heads of the biceps come together distally to insert on the radial tuberosity, just distal to the elbow joint. The forearm extensors consist of the anconeus and the triceps brachii. The anconeus originates on the lateral epicondyle of the humerus and inserts on the olecranon process of the ulna. The triceps brachii is a three-headed muscle with the long head originating on the infraglenoid tubercle of the scapula, and the lateral and medial heads originating on the posterior shaft of the humerus. The heads come together distally to insert on the olecranon process of the ulna. Although the biceps brachii is by far the largest of the forearm flexors, the brachialis generates about 50% more power and is therefore the prime mover of elbow flexion, with the brachioradialis and the biceps brachii acting as synergists. The prime mover of elbow extension is the triceps brachii muscle.
Biceps brachii is the large two-headed flexor muscle located in the anterior compartment of the arm. The origin of the long head is from the supraglenoid tubercle of the scapula. The origin of the short head is from the tip of the coracoid process of the scapula. The two heads insert by a common tendon onto the radial tuberosity and by the bicipital aponeurosis which blends with the deep fascia on the medial aspect of the forearm. Biceps brachii flexes the forearm at the elbow, supinates the forearm, and weakly flexes the shoulder. It is innervated by the musculocutaneous nerve. The origin of brachialis is from the distal one-half of the anterior surface of the humerus and adjacent intermuscular septa. The insertion is to the tuberosity and coronoid process of the ulna. Brachialis flexes the forearm at the elbow. It is innervated by the musculocutaneous nerve and a small branch of the radial nerve. The origin of brachioradialis is from the lateral supracondylar ridge of the humerus. The insertion is to the base of the styloid process of the radius. Brachioradialis is an especially strong forearm flexor when the forearm is in a semi-pronated position. It is innervated by the deep radial nerve.
Okay, the posterior extensor muscles include the triceps brachii, which is a forearm extender, so basically it opens the elbow up, and the anconeus, which is a weak synergist. And you can see here the triceps brachii, again, running essentially from the scapula and inserting all the way down onto the olecranon of the ulna, which is the medial bone of the forearm. And of course, when this muscle shortens, what it's going to do is it's going to extend the elbow. So let's take a look at the muscles across the elbow joint.
Although the biceps brachii is by far the largest of the forearm flexors, the brachialis generates about 50% more power and is therefore the prime mover of elbow flexion, with the brachioradialis and the biceps brachii acting as synergists. The prime mover of elbow extension is the triceps brachii muscle.
Triceps brachii is the large extensor muscle located in the posterior compartment of the arm. It has three heads of origin: the long head, the lateral head, and the medial head. The origin of the long head is from the infraglenoid tubercle of the scapula. The origins of the lateral head are from the posterior and lateral surfaces of the superior one-half of the humerus. It is located both superiorly and laterally to the radial groove. The origins of the medial head are from the inferior two-thirds of the medial and posterior surfaces of the humerus and is located inferiorly to the radial groove. Together, the three heads insert onto the superior and posterior surfaces of the olecranon process of the ulna. Triceps brachii extends the forearm at the elbow. It is innervated by the radial nerve.
And what you're looking at here is just a transverse section through the arm, and you can pick out now the humerus here in the middle. You can see the different heads of triceps brachii, and then over here, of course, the biceps brachii and the brachialis. Okay, remember that the triceps is a major elbow extender, while the biceps brachii and the brachialis are elbow flexors. So the triceps and the brachialis and the brachioradialis are antagonists of each other, and what they do is they help smooth each other's movements. This last chart is just showing you the actions of the muscles that act on the arm, the forearm, and the hand. Again, the major muscles and actions you need to know: the biceps brachii, brachialis, and the triceps brachii, and the brachioradialis. The rest I wouldn't worry too terribly much about. The main movements: elbow flexion, right, bending the elbow; elbow extension; pronation, which is the same as medial rotation of the forearm; and supination, which is the same as lateral rotation of the forearm. Okay, that brings this section of Chapter 10 to a close, and I'll see you in the last component, which is going to deal with the muscles of the hips and lower limbs in just a moment. Okay, this is the last installation of the discussion on the muscular system, and what we're going to deal with now are the muscles of the hip and the lower limbs. So we're going to begin with the muscles that cross the hip and the knee joint. And these are the muscles that are going to help you, among other things, walk and stand up straight. So most of the anterior muscles flex the femur at the hip. They extend the leg at the knee, such as when we have the swinging out of the foot, of the leg in front of you when you walk. Most of the posterior muscles extend the thigh and flex the leg. This is the backswing of walking. The medial muscles all adduct the thigh, so they bring it back towards midline, and all three muscle groups are enclosed by connective tissue known as the fascia lata. So let's take a listen to the muscles that cross the hip and the knee joints.
The largest muscles in the body are found in the lower limb and the associated hip joint. The hip joint is a ball and socket joint, which, similar to the shoulder joint, is capable of a considerable amount of movement. However, in contrast to the shoulder joint, the muscles of the lower limb are adapted more for strength than precision. Nevertheless, the muscles still show a complex array that can be separated into three categories: anterior muscles, medial muscles, and posterior muscles.
So these are muscles that allow movement of the thigh. Remember, the thigh is the upper leg, and they include flexion, extension, abduction, adduction, circumdiction, and rotation. The thigh flexors pass in front of the hip joint, and they include the iliopsoas, which is made up of the iliacus and the psoas major, which is a prime mover of flexion, so basically lifting the thigh up and decreasing the angle between the thigh and the trunk. The tensor fascia latae, which is this muscle here that inserts onto the iliotibial band and runs from the basically the iliac crest all the way down close to the tibial tuberosity, just below the patella. The rectus femoris, which is this big muscle here in the middle of the thigh, which is a member of the quadriceps group, and they're assisted by medial adductors and the sartorius muscle, also known as the Taylor's muscle, which runs across the front of the thigh and has almost an S shape to it. So let's take a look at the anterior hip muscles.
Principal anterior muscles of the hip are the iliacus and the psoas major. Collectively, they are known as the iliopsoas muscle because they share a common insertion on the lesser trochanter of the femur. The iliacus muscle originates on the iliac crest and fossa of the pelvis. The psoas major muscle originates on the bodies of vertebrae T12 through L5 and the transverse processes of all lumbar vertebrae.
Iliopsoas is one of a group of 9 flexor muscles that cross the hip joint. It consists of 3 separate muscles: the psoas minor, the psoas major, and the iliacus. Psoas minor is quite small, often absent, and is thus considered an unimportant member of the group. The origins of psoas major are from the vertebral bodies, transverse processes, and intervertebral discs of T12 through L5. The fibers run inferiorly and pass behind the inguinal ligament. They then wrap around the femoral head to insert onto the lesser trochanter. The origins of iliacus are from the superior 2/3 of the iliac fossa, the internal border of the iliac crest, and the ala of the sacrum. The fibers converge to insert onto the lesser trochanter with the psoas major tendon. The shared tendon is known as the iliopsoas tendon. With the origin fixed, the iliopsoas flexes the femur onto the trunk. With the insertion fixed and acting bilaterally, it flexes the trunk onto the femur. Psoas major is innervated directly by the lumbar plexus, while the iliacus is innervated by the muscular branch of the femoral nerve. The origins of tensor fasciae latae are from the anterior surface of the iliac crest and the anterior superior iliac spine. The fibers run inferiorly and insert onto the anterior surface of the lateral condyle of the tibia via the iliotibial tract. The tensor fasciae latae is a tensor muscle acting on the deep fascia or the fascia lata of the thigh. It maintains tension in the iliotibial tract to stabilize both the hip and knee joints. It is innervated by the superior gluteal nerve. The rectus femoris is the anterior member of the muscle group of the anterior thigh, known as the quadriceps femoris. Rectus femoris has two tendons. The straight tendon originates from the anterior inferior iliac spine and gives rise to the straight head. The reflected tendon originates from a groove superior to the rim of the acetabulum and gives rise to the reflected head. The fibers run inferiorly to insert onto the superior border of the patella and to the tibial tuberosity via the patellar ligament. The rectus femoris flexes the thigh at the hip and extends the leg at the knee. It is innervated by the femoral. The origin of sartorius is from the anterior superior iliac spine. The fibers run inferiorly and medially to cross the knee joint and insert onto the medial surface of the proximal tibia. Sartorius flexes the hip and knee joints and laterally rotates the hip joint. It is innervated by the femoral nerve.
Okay, looking here at the back of the thigh, we have some extensors. The hamstring muscles are the prime movers of extension, and they include biceps femoris, semitendinosus, and semimembranosus, as well as the gluteus maximus, which assists the hamstrings in forceful thigh extension. And what we have to understand about the hamstring muscles is that they are going to oppose the action of the quadriceps muscles to a large extent. They are important in flexing the knee. Okay, the gluteal muscles, the medius and the maximus, are important in extending and hyperextending the leg. So very important muscles used in walking. If you've ever heard of somebody getting a pulled hamstring, that it basically indicates that we've strained the tendons in one of the three muscles in this group: biceps femoris, semitendinosus, or semimembranosus. The biceps femoris is the most lateral muscle of the posterior thigh. The semitendinosus is the next most medial muscle, and the semimembranosus is the most medial muscle and lies under the semitendinosus as well as lateral to it. So let's take a look at movements of the thigh.
Biceps femoris is the lateral member of the muscle group located in the posterior thigh, known as the hamstrings. Biceps femoris has two heads, the long head and the short head. The origin of the long head is by a common tendon with a semitendinosus from the superior and medial surfaces of the ischial tuberosity. The origins of the short head are from the lateral lip of the linea aspera and the lateral supracondylar line of the femur. The fibers run inferiorly and laterally to insert primarily onto the lateral surface of the fibular head, but it also inserts on the adjacent surface of the lateral condyle of the tibia. Both heads of the biceps femoris flex the leg at the knee and laterally rotate the knee. The long head also extends the thigh at the hip. The long head is innervated by the tibial nerve. The short head is innervated by the common fibular nerve. Semitendinosus lies posterior to semimembranosus and is the most superficial member of the muscle group, located in the posterior thigh, known as the hamstrings. The origins of semitendinosus are by a common tendon with the long head of the biceps femoris from the superior and lateral surfaces of the ischial tuberosity. The fibers run inferiorly to insert onto the medial surface of the proximal tibia. Semitendinosus extends the thigh at the hip and flexes the leg at the knee. It also medially rotates the knee during flexion. Semitendinosus is innervated by the tibial nerve. Semimembranosus is the medial member of the muscle group located in the posterior thigh, known as the hamstrings. The origins of semimembranosus are from the superior and lateral surfaces of the ischial tuberosity. The fibers run inferiorly to insert onto the posterior surface of the medial condyle of the tibia. Semimembranosus extends the thigh at the hip and flexes the leg at the knee. It also medially rotates the knee during flexion. Semimembranosus is innervated by the tibial nerve.
Okay, the adductors adduct the leg, bring it back towards midline, but they also medially rotate the thigh. And there's a group of them, again, named for their action and also their size. The adductor magnus, the adductor longus, the adductor brevis, and the smallest of the group, the pectineus, and the most medial of the group, the gracilis. Okay, so you can see each of these indicated in the drawing. There's the pectineus, this very, very tiny muscle up here in the adductor group, and then it goes brevis, longus, and then this big guy here is the magnus, and then the gracilis would essentially be a strap-like muscle that runs all along the medial thigh, right along here. Okay, so let's take a look at what each of these muscles do.
There are 5 medial muscles that cross the hip joint: the adductor magnus, the gracilis, the pectineus, the adductor brevis, and the adductor longus. The adductor magnus originates on the inferior ramus of the pubis, as well as the ramus and tuberosity of the ischium. The muscle inserts on the linea aspera, the gluteal tuberosity, and the medial supracondylar line of the femur. The gracilis muscle originates on the body and inferior ramus of the pubis, and the ramus of the ischium. The insertion is on the medial surface of the tibia, just below the tibial condyle. The pectineus muscle originates on the superior ramus of the pubis, and inserts on the spiral line of the femur. The adductor brevis originates on the body and inferior ramus of the pubis, and inserts on the linea aspera of the femur. The adductor longus originates on the body and inferior ramus of the pubis, near the pubic symphysis, and inserts on the linea aspera of the femur, below the adductor brevis.
The origins of pectineus are from the pectineal line of the pubic bone and the adjacent surfaces on the superior ramus. The fibers run inferiorly and wrap around to the posterior femur and insert onto the pectineal line. The pectineus flexes the thigh at the hip and adducts the hip. It is innervated by the femoral and sometimes the obturator nerve.
The abductors do the opposite. They pull the leg away from midline. They include the gluteus maximus, medius, and minimus. The maximus is the largest and most superficial of the gluteus muscles. The medius lies underneath it, and the minimus lies underneath the medius. And so you can see them actually here in the cutaway. There is the maximus, there is the medius, and there is the minimus. The piriformis is a pear-shaped muscle. You can see it right here, and it also laterally rotates the thigh. And then there are two sets of muscles called the superior and inferior gemellus that run underneath the obturator internus. Again, these are deep muscles of the thigh. And right here, you've got the quadratus femoris. Do not confuse this with the quadriceps femoris. And what all of these do, again, is assist with extending the leg, laterally rotating the thigh, and medially rotating the thigh. You can see the action of these muscles here.
The posterior muscles that cross the hip joint begin with 6 deep muscles that are collectively referred to as the lateral rotators, named for their action on the femur. They are the gemellus superior, the gemellus inferior, the obturator externus, the obturator internus, the piriformis, and the quadratus femoris. Superficial to the lateral rotators are the 3 gluteal muscles: the gluteus minimus, the gluteus medius, and the gluteus maximus. And located laterally is the tensor fasciae latae. The gemellus superior originates on the ischial spine and inserts on the greater trochanter of the femur. The gemellus inferior originates on the ischial tuberosity and inserts on the greater trochanter of the femur. The obturator externus originates on the outer surfaces of the obturator membrane, the pubis, the ischium, and the margins of the obturator foramen. The insertion is in the trochanteric fossa of the femur. The obturator internus originates on the inner surface of the obturator membrane and the margins of the obturator foramen. The insertion is on the greater trochanter of the femur. The piriformis originates on the anterior surface of the sacrum and inserts on the greater trochanter of the femur. The quadratus femoris originates on the ischial tuberosity and inserts on the intertrochanteric crest of the femur. The gluteus minimus and medius originate on the lateral surface of the ilium and insert on the greater trochanter of the femur. The gluteus maximus originates on the dorsal ilium, the sacrum, and coccyx, and inserts on the gluteal tuberosity of the femur and the lateral condyle of the tibia via the iliotibial band. Tensor fasciae latae originates on the iliac crest and the anterior superior iliac spine and inserts on the tibia via the iliotibial band.
The gluteus maximus is the large fleshy muscle that forms the bulk of the buttock. The origins of gluteus maximus are from the posterior ilium, sacrum, coccyx, and the sacrotuberous ligament. Some deep fibers insert onto the gluteal tuberosity of the femur. However, the majority of the fibers insert onto the iliotibial tract of the fascia lata. The gluteus maximus is the most powerful extensor of the thigh at the hip. It also assists in lateral rotation of the thigh. It is innervated by the inferior gluteal nerve. The origin of gluteus medius is from the posterior ilium, inferior to the iliac crest. The insertion is to the lateral surface of the greater trochanter of the femur. The gluteus medius abducts and medially rotates the thigh. Along with gluteus minimus, it also stabilizes the pelvis laterally. It is innervated by the superior gluteal nerve.
Two principal anterior muscles of the hip are the iliacus and the psoas major. Collectively, they are known as the iliopsoas muscle because they share a common insertion on the lesser trochanter of the femur. The iliacus muscle originates on the iliac crest and fossa of the pelvis. The psoas major muscle originates on the bodies of vertebrae T12 through L5 and the transverse processes of all lumbar vertebrae.
Okay, now remember that the quadriceps muscles, which are found on the front of the thigh, are knee extenders. So these are the muscles that, in large part, allow you to kick, while the hamstring muscles flex the knee and are antagonists to the quadriceps. So essentially, if the knee is extended by the quads, then it can be flexed by the hamstrings. Those are the two principal movements of those muscle groups. And you can see here the quadriceps muscles as we number them. This is the rectus femoris, the vastus lateralis, the vastus medialis, and underneath the rectus femoris is a fourth muscle in the group of four, which is called the vastus intermedius. Superficial muscles that run across include the sartorius and the tensor fascia latae, and then you've got the adductor muscles here, the longus, the brevis, the magnus, and then this little strap-like muscle here, the gracilis. Okay, um, all of these guys principally bring the leg back towards midline. When we say the leg, we mean really the thigh. So let's take a look at muscles of the thigh that move the knee.
Muscles that act on the knee joint form most of the mass of the thigh and are located both anteriorly and posteriorly.
You can see here the hamstring group along with the gluteal muscles. The gluteus maximus, of course, the largest and most superficial of the gluteal group. It is a major leg extender and hyperextender. The gluteus medius, which assists the gluteus maximus, and the minimus, which lies underneath the medius. And we saw the deeper muscles of the hip in the earlier slide. We took a look at the muscles that lie inferior to the medius and the minimus, which include the piriformis, the superior and inferior gemellus, and between them the obturator internus, and of course the quadratus femoris, a little square muscle that lies right about here. Okay, the hamstring muscles you can see from the back: biceps femoris, semimembranosus, semitendinosus, main action to bend the knee, and also to some extent to extend the leg. So let's take a look at the muscles of the thigh that move the knee joint.
The posterior muscles of the thigh that flex the knee are the biceps femoris, the semimembranosus, and the semitendinosus, collectively referred to as the hamstring muscles. Also included as a flexor muscle of the knee is the popliteus muscle. The long head of the biceps femoris muscle originates on the ischial tuberosity of the pelvis, and the short head on the linea aspera and lateral supracondylar line of the femur. The insertion of the biceps femoris muscle is the head of the fibula. The semimembranosus muscle originates on the ischial tuberosity of the pelvis and inserts on the medial condyle of the tibia. The semitendinosus muscle originates on the ischial tuberosity and inserts on the medial surface of the tibia. The popliteus muscle originates on the lateral condyle of the femur and inserts on the posterior surface of the tibia.
The rectus femoris is the anterior member of the muscle group of the anterior thigh, known as the quadriceps femoris. Rectus femoris has two tendons. The straight tendon originates from the anterior inferior iliac spine and gives rise to the straight head. The reflected tendon originates from a groove superior to the rim of the acetabulum and gives rise to the reflected head. The fibers run inferiorly to insert onto the superior border of the patella and to the tibial tuberosity via the patellar ligament. The rectus femoris flexes the thigh at the hip and extends the leg at the knee. It is innervated by the femoral. Vastus lateralis is the lateral member of the muscle group of the anterior thigh, known as the quadriceps femoris. The origins of vastus lateralis are from the greater trochanter, the intertrochanteric line, and the lateral lip of the linea aspera of the femur. The fibers run inferiorly to insert onto the quadriceps femoris tendon, the superior and lateral borders of the patella, and to the tibial tuberosity via the patellar ligament. The vastus lateralis extends the leg at the knee. It is innervated by the femoral nerve. Vastus intermedius is the intermediate and deep member of the muscle group of the anterior thigh, known as the quadriceps femoris. The origins of vastus intermedius are from the anterior and lateral surfaces of the shaft of the femur. The fibers run inferiorly to insert onto the deep part of the superior border of the patella and to the tibial tuberosity via the patellar ligament. The vastus intermedius extends the leg at the knee. It is innervated by the femoral nerve. Vastus medialis is the medial member of the muscle group of the anterior thigh, known as the quadriceps femoris. The origins of vastus medialis are from the intertrochanteric line of the anteromedial femur, from the linea aspera, and the medial supracondylar line of the posterior femur. The fibers run inferiorly to insert onto the quadriceps femoris tendon, the superior and medial borders of the patella, and to the tibial tuberosity via the patellar ligament. The vastus medialis extends the leg at the knee. It is innervated by the femoral nerve.
Muscles that act on the knee joint exhibit two actions: flexion and extension of the knee. Knee flexion is the result of the hamstring muscles as the prime movers, and the popliteus and sartorius muscles as synergists. More specifically, the sartorius muscle aids in flexion, while the popliteus muscle acts to unlock the knee to allow for flexion to occur. Extension of the knee is the result of the quadriceps femoris muscle, suggested by some to be the most powerful muscle in the body.
Okay, different leg muscles produce the following movements. Now we're talking, when we refer to the leg, of the calf, okay, the lower leg, if you want to use a colloquial term, and they act at the ankle for dorsiflexion and plantar flexion. Dorsiflexion would be lifting the toes off the ground. Plantar flexion would be pointing the toes. The intertarsal joints that involve inversion and eversion of the foot, and also flexion and extension of the toes. And you can see some of these major muscles. We're looking here at the anterior aspect of the calf. Primary toe extensors and ankle dorsiflexors include the tibialis anterior, named because it runs in front of the tibia, the extensor digitorum longus, which gets its name from its action, which is to extend the toes, the extensor hallucis longus, which extends the big toe, and the fibularis tertius, which is a minor muscle that we don't need to concern ourselves with. So let's take a listen.
The anterior compartment of muscles that act on the ankle and foot contains the fibularis tertius muscle, the extensor hallucis longus muscle, the extensor digitorum longus muscle, and the tibialis anterior muscle. The fibularis tertius muscle originates on the medial lower one-third of the fibula and the interosseous membrane, and inserts on the dorsal surface of metatarsal 5. The extensor hallucis longus originates on the anterior surface of the fibula and the interosseous membrane, and inserts on the distal phalanx of the big toe, or the hallux. The extensor digitorum longus originates on the lateral condyle of the tibia, the interosseous membrane, and the shaft of the fibula. The insertion is on the middle and distal phalanges 2 through 5. The tibialis anterior muscle originates on the lateral condyle and upper 2/3 of the tibia and the interosseous membrane. The insertion is on the medial cuneiform and metatarsal 1.
The origins of tibialis anterior are from the lateral condyle of the tibia, the shaft of the lateral tibia, and the interosseous membrane. The insertion is to the medial and plantar surfaces of the medial cuneiform and the base of metatarsal 1. Tibialis anterior dorsiflexes the foot at the ankle and assists in inversion of the foot. It is innervated by the deep fibular nerve. The origins of extensor digitorum longus are from the lateral condyle of the tibia, the proximal 3/4 of the anterior surface of the fibula, and the interosseous membrane. The fibers run inferiorly to divide into 4 tendons that insert onto digits 2 through 5. Extensor digitorum longus extends the metatarsophalangeal joints of digits 2 through 5. It assists in extension of the interphalangeal joints of digits 2 through 5. It also assists in dorsiflexion of the foot. It is innervated by the deep fibular nerve. The origins of extensor hallucis longus are from the middle of the anterior surface of the fibula and the interosseous membrane. The insertion is to the base of the distal phalanx of digit 1. Extensor hallucis longus extends all joints of the big toe and assists in dorsiflexion of the foot. It is innervated by the fibular nerve.
Okay, we're looking here at lateral aspect of the lower leg. These muscles are involved in plantar flexion and eversion of the foot. Plantar flexion would be pointing the toe, and eversion of the foot would be essentially moving the sole of the foot outward away from midline. It stabilizes the lateral ankle and the lateral longitudinal arch of the foot, and the main muscles are the fibularis longus and the fibularis brevis. And again, they're named for their relative size and their location. Fibularis because it runs near the fibula. The fibularis brevis, of course, is the shorter muscle and the deeper muscle. and the fibularis longus, of course, is the longer muscle. But they're both, again, important in eversion of the foot. These guys run along the lateral aspect and they attach down near the base of the ankle, and as a result allow eversion of the sole of the foot. So let's take a listen.
The lateral compartment of muscles that act on the ankle and foot contains the fibularis brevis muscle and the fibularis longus muscle. The fibularis brevis muscle originates on the lateral surface of the fibula and inserts at the base of metatarsal 5. The fibularis longus muscle originates on the head and upper portion of the lateral fibula and inserts on the medial cuneiform and metatarsal 1.
The origins of fibularis longus are from the head of the fibula and from the proximal 2/3 of its lateral surface. The tendon of fibularis longus passes posterior to the lateral malleolus of the fibula and then medially across the foot to the sole. Its insertions are to the lateral surfaces of metatarsal 1 and the medial cuneiform. Fibularis longus everts the foot and assists in plantar flexion of the foot at the ankle. It is innervated by the superficial fibular nerve.
Okay, here you can see the back of the calf, and you're looking at two very important muscles that are involved in pointing the toe. These include the gastrocnemius, which is the most superficial of the muscles. It inserts via the calcaneal or Achilles tendon onto the calcaneus, which is your heel bone, and under it is a muscle called the soleus, which assists in this action. And then the plantaris muscle is a deeper muscle that also helps with pointing the toe. The popliteus we've discussed, it's a minor muscle at the back of the knee. The flexor digitorum longus and hallucis longus oppose the action of the extensor digitorum longus and extensor hallucis longus. Basically what they do is they curl the toes, okay? And then, of course, we got the tibialis posterior, named because it runs along the back of the tibia. So you could think of really three muscles here that help you point your toe. The gastrocnemius, under it the soleus, and under a couple of other muscles, the tibialis posterior. So let's take a look at the muscles of the posterior compartment of the leg.
The posterior compartment of muscles that act on the ankle and foot contains both deep and superficial leg muscles. The deep posterior compartment contains the tibialis posterior muscle, the flexor digitorum longus muscle, and the flexor hallucis longus muscle. The tibialis posterior muscle originates on the tibia, the fibula, and the interosseous membrane. The insertion is on the navicular, the medial cuneiform, and metatarsals 2 through 4. The flexor digitorum longus muscle originates on the tibia and inserts on the distal phalanges of digits 2 through 5. The flexor hallucis longus muscle originates on the fibula and interosseous membrane and inserts on the distal phalanx of the hallux. The superficial posterior compartment contains the soleus muscle and the gastrocnemius muscle. The soleus muscle originates on the proximal 1/4 of the fibula and the middle 1/3 of the tibia. The insertion of the muscle is on the calcaneus. The gastrocnemius muscle originates on the medial and lateral condyles of the femur and inserts on the calcaneus.
Gastrocnemius is the large superficial muscle occupying the posterior compartment of the leg. Gastrocnemius has two heads. the medial head, and the lateral head. The origin of the medial head is from the posterior femur, superior to the medial condyle. The origins of the lateral head are from the lateral condyle and the posterior surface of the femur. As they pass inferiorly, the two heads converge and give rise to the calcaneal tendon, which inserts onto the posterior calcaneus. Gastrocnemius plantar flexes the foot at the ankle and assists in flexion of the leg at the knee. It is innervated by the tibial nerve. Soleus is located in the posterior compartment of the leg, deep to gastrocnemius. The origins of soleus are from the proximal 1/3 of the posterior fibula and the soleal line of the posterior tibia. Soleus passes inferiorly and merges with the deep layer of the calcaneal tendon, which inserts onto the posterior calcaneus. Soleus plantar flexes the foot at the ankle. It is innervated by the tibial nerve.
Okay, here you can see some of the deeper muscles of the posterior compartment of the leg. And what we're looking at here are the flexor digitorum and hallucis longus. You can see a little bit of the fibularis brevis. And if you look really close, you can see one of the deepest muscles, which is the tibialis posterior, again, which runs on the backside of the tibia. And what most of these muscles do, again, is assist in pointing the toe. Okay, so they help you to push off on the ball of your foot. They're also involved in movement of the toes themselves. Okay, they flex the toes as well as plantar flexing the foot. So let's take a listen.
The origins of tibialis posterior are from the lateral surface of the posterior tibia, the shaft of the medial fibula, and the interosseous membrane. The tendon of tibialis posterior passes posterior to the medial malleolus of the tibia and inserts onto the medial surface of the navicular bone, the plantar surfaces of the three cuneiforms, and to the bases of metatarsals 2 through 4. Tibialis posterior inverts the foot and assists in plantar flexion of the foot at the ankle. It is innervated by the tibial nerve. The origin of flexor digitorum longus is from the posterior surface of the tibial shaft. The tendon of flexor digitorum longus runs posterior to the medial malleolus of the tibia and then passes to the sole of the foot, where it divides into 4 tendons. These insert onto the bases of the distal phalanges of digits 2 through 5. Flexor digitorum longus flexes all of the joints of digits 2 through 5. It assists in plantar flexion of the foot at the ankle and inversion of the foot. It is innervated by the tibial nerve. The origin of flexor hallucis longus is from the posterior surface of the fibular shaft. The tendon of flexor hallucis longus passes posterior to the medial malleolus of the tibia and inserts onto the base of the distal phalanx of digit 1, also known as the big toe. Flexor hallucis longus flexes all of the joints of digit 1 and assists in plantar flexion of the foot at the ankle. It is innervated by the tibial nerve.
Okay, so remember that the major actions of the muscles that act on the thigh, the leg, and the foot are essentially flexion, extension, abduction, adduction, and when we get down to the ankle, we include dorsiflexion, plantar flexion, inversion and eversion of the foot, and also circumdiction. So let's take a look at the major actions of muscles that act on the ankle and the foot.
Muscles of the anterior compartment of the leg induce dorsiflexion of the ankle and assist in inversion and eversion of the foot. The prime mover of dorsiflexion is the tibialis anterior muscle, with the extensor digitorum longus muscle, the fibularis tertius muscle, and the extensor hallucis longus muscle acting as synergists. Dorsiflexion is important in preventing the toes from dragging or scuffing the ground while walking. Inversion of the foot results from contraction of the tibialis anterior muscle. The fibularis tertius muscle aids in eversion of the foot. Muscles of the lateral compartment of the leg, the fibularis longus muscle, and the fibularis brevis muscle, evert the foot and act as synergists. Muscles of the posterior compartment of the leg elicit plantar flexion and foot inversion. Plantar flexion is induced through contraction of the gastrocnemius muscle and soleus muscle as the prime movers, with the flexor digitorum longus muscle, the flexor hallucis longus muscle, and the tibialis posterior muscle as synergists. Plantar flexion is the most powerful movement of the ankle, allowing the entire body to be lifted and supported during a tiptoe, and providing forward thrust while walking or running. Foot inversion occurs through contractions of the tibialis posterior muscle as the prime mover, and the flexor digitorum longus muscle and the flexor hallucis longus muscle as synergists.
So the next two slides are just showing you a summary of the actions that the muscles that act on the thigh, the leg, and the foot. Remember to be able to differentiate between the movements of the hip joint that include flexion, extension, abduction, adduction, and medial and lateral rotation. Okay, just if you want, get up and like perform those movements right now. We'll do them in class as well. And then actions at the knee, of course, include flexion and extension. And here we just have a continuation of actions at the foot and at the ankle. Remember, plantar flexion is pointing the toe, dorsiflexion is raising the toe, inversion is to turn the sole of the foot towards midline, and eversion is to turn the sole of the foot away from midline. Flexion of the toes is essentially um, basically curling the toes under, and extension of the toes is basically spreading the toes out and up. Okay, so that should give you a good idea of the different movements. Okay, make sure and review this material because it will show up on a quiz or exam, and I'll see everybody in class. Thank you.